All right, everyone, when examining the leg, you just want to pay attention to the names of the muscles. I labeled it for you so you can use it, and I'm just going to sort of orientate you around this model since it's not available. And so typically try to keep in mind that this is going to be anterior or the front of the leg, right? Because here are the toes, and the posterior segment's going to be on the very back end. And then you also have a compartment to worry about when you're dealing with the leg, in that you have a medial compartment or a compartment in the midline. It's closer to the midline of the body, usually indicated by the toe. So with that in mind, first muscle that we want to learn about is iliacus. Okay, that's going to lie on this ischial bone. It sort of starts with an I. Let that sort of remind you of that, iliacus. Next, we have this ribbon-like one, sartorius, which actually goes all the way to the back, and it also has almost the same actions as the ones on the back end. But make sure to refer to your table for the actions for these. Then we have adductor longus. If we progress medially, you're going to see this nerve, this artery, this vein, and as you go through it, this next muscle here is going to be adductor longus, and then gracilis. Both of them are going to be responsible for adduction, but again, refer to your table for the actions. When we look at the anterior compartment, here you're going to see that we have three that sound almost identical. We have vastus medialis and vastus lateralis, and those are going to be two of four muscles, the quadriceps. And so this center one here is our rectus femoris, and it divides both vastus medialis and lateralis. And don't forget that usually medialis is going to mean medial, so you can always just look at the toe, and that's how you know you're at the midline, just in case, and since you're pressed for time. And with that, if you open this one up, and you kind of have to, is that underneath this bone, under this muscle, the rectus femoris, you'll see our vastus intermedius, which lies in between the medialis and the lateralis, and that's that center one that you'd have to sort of remove this one. It could be asked there, or maybe it might even be asked under this, but I'm pretty sure it would be asked right there. So with that, now we go to the posterior portion of the upper thigh. When we look at this term here, this is going to be our semitendinosus, this one on top, and then you'll notice that there's going to be two little underlying ones. This lies underneath the semitendinosus. This is your semimembranosus, and this is going to lie underneath your semitendinosus. Then if we go again more to the pinky side, right, the side with your pinky, or more appropriately the lateral side, this is going to be your bicep femoris, which is next to your semitendinosus. And these three muscles are essentially going to be responsible for flexion of the knee, but refer to your table for the definitions of the actions. And with that, now we can progress down, or distally, right? We can progress in a distal direction on the limb. And then some of the first muscle we can learn about here on the pinky side or the lateral side is going to be our fibularis longus. And if we progress to the anterior side, down at this very bottom portion here, this one, the sticker's sort of covering the rest of this muscle, so let me lift it, but that's going to be that number right there, 44. It's going to be really small, and you can see it lies underneath another muscle. So you really only get to see a piece of it on that side, and that's really it, because it's just this tiny portion. I'm trying to do this with one hand here. Yes, just that tiny portion in that region. All right. And so if we progress to the posterior portion now, here we have our gastrocnemius, which is misspelled incorrectly, and I had a student make this for me, so it's misspelled. Please figure out the spelling for this. It's missing a C, okay? And then so gastrocnemius is going to be your calf muscle, and here we have your plantaris, which is just going to be this segment on top there, just that little portion. But for the most part, all of this is your gastrocnemius. And then we have our soleus, and our soleus is going to be this last remaining muscle. You can see it from this side, the lateral side, because when you look at the gastrocnemius, you can see that as you follow, there's one more little line there. That's going to be your soleus. Okay, and so just on this chunk alone, you have three muscles that I like to just jokingly call GPS, gastrocnemius, plantaris, and soleus, just on this region there. Okay, and they're all going to be responsible for the most part plantar flexion. So that's really nice that you can actually group them. And so that's the nice thing about this little muscle chunk here. And that's really it for the leg. And make sure to see the accompany table that's next to your this video, so that way you can actually learn the actions once you've learned how to ID these muscles.